I'm going to give an update on our immunization program and the vaccination status and what how we're managing that in British Columbia. I know I had given some of this information prior to the Christmas break, but we have more details now, and we have additional information, particularly from the National Operations Centre, and some guarantee of when some of our vaccine will be arriving. So a recap of some of the important information about our BC immunization plan. For the first quarter, so what we're talking about are the doses that we received early in December, but for January, February, and March, all of our Pfizer and Moderna vaccine will be prioritized for administrations to priority populations, and particularly as their first dose for the doses we received in December and into January. We've made that decision based on trying to protect as many people as possible during this highest risk period, and making sure that we are still able to give second doses within a reasonable amount of time. And to do that, we have delayed the second dose to approximately 35 days for most people in this first phase, as we know that now additional vaccines will be coming later on in February and March. And the scheduling of these priority groups will vary a little bit as we deal with additional outbreaks in our communities, in long-term care in particular, and in many communities. So we initially put out some more details of what the thinking was, aligned with the National Advisory Committee on Immunization for quarter two. So that's April, May, June of this year. We are now working through what those details will look like, and we will be presenting near the end of January more details similar to what we're presenting today for additional populations. Our focus right now with the vaccines that we know we have coming in the coming few weeks is on these priority populations, and I'll run through these again in some detail. So from December to February, we aim to immunize approximately 150,000 individuals. And I will make a note that we have received a certain amount of vaccine, or we're guaranteed to receive a certain amount of vaccine for quarter one of 2021. Some of that vaccine, thankfully, came to us early. It doesn't mean that the doses that we received in December are added on to those we're expecting to receive in January, February, and March. It's the same amount that we're expecting to receive in the 3 months. Some of it just came early in December. So our focus for the next month till the end of January, so from the doses we received already to February, is residents and staff of long-term care. And we have said that from the very beginning. Those are the people that we know need our protection most. And that's approximately 70,000 individuals across the province. We're also know that people who are living in assisted living are also at higher risk because of the communal living setting for this to be spread very, very quickly. And that's approximately 13,000 individuals. We also want to make sure that those people who are in hospitals right now awaiting placement in a long-term care home are protected so that they can get into those care homes as soon as they're available. And that includes about 2,000 people in awaiting long-term care placement, either in the community or in hospitals. As well, we know that it has been the most challenging for families and those with loved ones in long-term care and assisted living, and we will be ensuring as well that essential visitors are able to access immunization. Our second important goal, of course, is to make sure that our healthcare system is protected and is able to operate and efficiently. And we have seen a number of outbreaks in our acute care facilities, and not only does it affect operations because of people being sick and it being transmitted, but also staff need to be off because they have been exposed. So it is important for us to make sure that we are protecting particularly those people who are on the front line of about the COVID response and keeping our health system available for everybody else. And that includes ICU, emergency departments, paramedics who do transports back and forth and work in long-term care and in our hospitals, and key people for the response. And that's approximately 30,000 healthcare workers around the province. In addition, we have an important commitment to remote and isolated First Nations communities that we've seen the devastation that can happen if this virus gets into those communities. As well, we know the access to care is much more challenging, particularly as we're heading into winter months. Once we get into February, with the vaccine that we are expecting to have in January, we are hoping and we're planning to get through that group of people. Once we get into February, we don't yet have guaranteed doses of vaccines, the actual numbers that are going to arrive in February, but we expect that will be coming up this week, and that we'll have a better idea of exactly how many doses we will have each week through February and March. And it is this system that we're getting into across the country of testing the system, making sure the planning and the logistics is getting into place. And that is coming together. It has been challenging, and as we mentioned when we started this, we are learning. There has been bumps and delays, and we'll talk a little bit about some of those in a minute. But after we finish this first high risk and high priority groups, we'll be moving into priority populations that are also the same ones we were talking about for the following 2 months of quarter one. And that's about 400,000 people will get their dose 1, given the way that we have set up our schedule. That includes community-based seniors over the age of 80. And for Indigenous people, we've lowered that age group, recognizing the higher risk of having some more severe illness in that age group. People experiencing homelessness and using shelters, and as we've mentioned as well, we've had a number of outbreaks, particularly the downtown east side. We've had a couple of shelter outbreaks in Fraser Health, and again, people who are in using shelters, who are in those situations, are much more likely to end up in hospital. As well, we have a responsibility for other communal living where we know people are at risk, and that includes our correctional facilities, group homes, and mental health residential care. We are also looking at how we can identify people who have home care and home support, and making sure both recipients and staff who work in those sectors are immunized as a priority, and additional both hospital staff and community healthcare workers, including GPs and specialists and others. As well, we are continuing our work with First Nations communities to identify the at-risk communities across BC. So that is our plan for what we know right now for the first quarter of 2021. Once we get through that, we know, at least from the contracts that we know are the health that Canada has in place with both Pfizer and with Moderna, as well as additional seven in total additional contracts with the other vaccine manufacturers. What we have been told is that the contracts for Pfizer and Moderna will scale up come March. So we are expecting to have way more of those vaccines once we get into April, May. We also expect approval in Canada of additional vaccines, and we've heard that the AstraZeneca vaccine has been approved for use in the UK. We know that Health Canada has received at least some of the data and has started the expedited review process, both for AstraZeneca and Janssen. We don't know the exact timelines, but we're hopeful that those will be approved for use in Canada sometime in the first quarter of this year as well. However, the thing that we also know is the contracts, particularly for these vaccines, don't come into play until quarter 2 in Canada. So we may not receive the Janssen & Janssen or the AstraZeneca vaccine until April, depending on the contracts and depending on production worldwide. So there's a lot of unknowns still about those vaccines, although we are, of course, hopeful. The AstraZeneca vaccine, as we know, is very effective, and it can be transported at fridge temperatures, which makes it much easier for us to use. So contingent on supply, our plan is to begin our mass vaccination strategy based on age and then descending in 5-year cohorts after our 80-plus priority population is completed. And we are working on how do we do that to make sure that it's accessible and fair for people around the province. And we will be detailing that later on this month. So to go back, the estimated number of doses from December to March that we are expecting, both of Moderna and Pfizer, is about 792,000 doses. And our plan is to provide at least 549,000, 550,000 people their first dose, and some of those people will also receive their second dose. So that's approximately 542,000 doses of Pfizer and 250,000 doses of the Moderna vaccine. So we, as I mentioned, we're still working. Now we're about 3 weeks ahead of time. We were in a just-in-time loop, but it's settling out across the country, and we have a better idea a little bit further down the line of how much vaccine we're going to receive each week. So as of January 4th, as of today, we have received 54,625 doses of vaccine in the province. Of that, 34,125 doses were of the Pfizer vaccine. Our very first week, we received it 3,900 doses, so a very small amount, as you recall, in both one place in Fraser, one place in Vancouver Coastal, as a way to test and proof the system. The week of December 21st, we received an additional 22,425 doses of the Pfizer vaccine, and it was distributed to all health authorities and was around the province. It came at various days through the week of December 21st, so it didn't all arrive on Monday. It arrived between the Tuesday and Thursday around the province, and last week, December 28th, we received additional 7,800 doses, all in Fraser Health. The Moderna vaccine, which we're very excited, received approval and notice of compliance on in late December, December 23rd. We received one shipment of 20,500 doses, and it arrived, most of it arrived actually on December 31st. It was to arrive the week of December 28th, and we did receive some on the 28th and through to the 31st. And again, it was received in all health authorities, and the First Nations Health Authority as well received some as per our agreement, working together to provide vaccine to high-risk, remote and isolated communities. So we expect to receive an additional 16,575 doses of the Pfizer vaccine this week, January 4th, the week of January 4th. We've not yet received it. We have just received the packing labels, so we expect it to arrive within the following 2 to 3 days, depending on where it's going in the province. I will note that the next shipment of our Moderna vaccine is not expected until the 3rd week of January, although it is varying a little bit. So the Moderna vaccine in Q1 will be coming at 2 to 3 week intervals, where the Pfizer vaccine, we're now in a place of receiving it weekly. So as we've talked about a little bit over the last few days, there's been a lot of planning and preparation that's required for these vaccines. They are not our usual fridge-stable vaccines that we're used to handling. They are very delicate, and both the Pfizer and the Moderna in particular are very delicate in how they're made, and they need to be handled very cautiously, most of it while frozen. So we have done a lot of work preparing for the logistics, whether it's security, handover, temperature controls. The temperature controls are read for every single box in every package centrally through Pfizer, and we need to have approval before it can be taken out of the shippers, etc. There's a lot of things that we're not used to having to do when we're handling vaccines, including ultra-low temperature gloves, being able to work with liquid nitrogen, the thermal containers, which are quite heavy, and how do you get them from one place to another. As well, we've been planning and preparing for the redistribution logistics. So taking the vaccine that's frozen in the, we call them the pizza boxes, and being able to move them to other places. Again, the permission to do that from the company was only received the week before Christmas on the 21st or 22nd, and the shippers, they have the special containers that you need to keep them in to move them to other places were coming online as well. As well, we need to plan and coordinate the immunization clinics, making sure that immunizers understand the products, how they're reconstituted, how much is in a dose, what the side effects are, the details that we need to do as clinicians to make sure we can safely provide vaccine to people and know how to deal with the adverse effects should some of them happen. And we know, of course, about things like having allergic reactions to vaccines, which can happen at clinics and which we need to be prepared for. Additionally, we needed to ensure we have a system in place that records everybody's immunization, so we know exactly what lot of which vaccine they received. One, so that we can monitor for safety, which we do very carefully, and also so that we make sure people get the right vaccine for their second dose. So I'm not going to go through all of this, but it's here for you about the Pfizer distribution and logistics, which we say are quite fussy. They have limits on how it can be moved and what size, how many doses you can move and redistribute at any point in time. And then how long they can be kept once they're out of the freezer and thawed. So up until today, the Pfizer vaccine has been allocated in British Columbia in the following. So Fraser Health has the majority as the largest population, gone in small amounts to each health authority, and with specific targeted amounts to the First Nations Health Authority around some of the remote and isolated communities. So this has allowed us to redistribute this vaccine not only to those remote communities where the need is great, but also to long-term care and assisted living sites directly, and makes it much easier for us to provide vaccination, particularly in some of our smaller communities, to residents of long-term care. And there's a mixture in places like Vancouver and Fraser Health, where they have the capacity to transport the Pfizer vaccine in the urban area in the higher amounts. So a lot of it has been figuring out how much needs to go where in the last little while. And to date, there's been distribution to many rural and remote First Nations communities, prioritized based on risk and need and the numbers of seniors and elders in the communities. And our First Nations Health Authority has been working with all of us very closely on this, and the nursing station and community clinics will be delivering these doses through this week. So that is very exciting news. We saw some wonderful pictures of elders receiving their vaccines in some places of the province just this past weekend. So that's good news. Up until including today, about 1,600 doses of Moderna will have been administered in BC. As I mentioned, really the majority of it arrived on December 31st, so it has been a slower rollout than we were hoping, but we will be using up the additional doses over the coming week. So up until close of clinics yesterday, we had vaccinated 24,139 people, and 22 of that, 690 was from the Pfizer, and about 1,449 people received the Moderna vaccine. So if we look at where did this vaccine go, about 20% of it made it to residents of long-term care, and That's in the limited time that we've been able to get it out, actually 2 residents. Just under half has gone to staff of long-term care, and that's where we started, recognizing that staff could come to the vaccine centres where we had the Pfizer vaccine. We have a small percentage for staff and residents of assisted living, and another third approximately for healthcare workers in the various settings that we've talked about. So for our next 2 weeks, in particular, to January 18th, we are planning on we will deliver the remaining doses from December and January, and the about 16,575 additional doses we have arriving this week. And the focus, as I've mentioned, will continue to be on long-term care and assisted living, making sure that we are protecting those who are most vulnerable in our communities, and then coverage of our front lines of acute care and ongoing immunization in our at-risk First Nations communities. So that is where we are with immunization. It's a monumental task, and there are many months left to go in this. We are constrained by logistics and also by how much vaccine we're receiving, but we're optimistic, and we are focused intensely on making sure we protect people in long-term care and assisted living as quickly as we possibly can, and of course protect those most at risk in our communities.